Let's discuss hallucination. Just like we discussed delusion is a psychotic symptom, also remember hallucination is also a psychotic symptom. Very important, okay. We'll discuss the difference between neurosis, psychosis in a while. Remember, it is also a psychotic symptom, can be seen in psychotic conditions such as schizophrenia, acute psychosis, even in other condition, even sometimes with substances also, even with mood disorder. But remember, it is a psychotic symptom. Now, it is a false perception without any real object. So for example, a person is watching this video and the person, the patient says, sir, on the screen along with you, on the left side of you, I can see another person sitting. And the person is also able to tell, sir, he is wearing a white hat, he is wearing a black shirt and he is having a mustache. Now, can you see other than me on the screen sitting along? But he is able to see. So he is able to see, that means it's an abnormality of perception. So it is a hallucination. Without any real object, the person is still able to perceive some perception. So this is a hallucination. I hope this is clear to everyone. Now there is one very important phenomena which I want you to remember, that so hallucination and pseudo hallucination. Okay. Now both of them are very similar. Both of them are very clear to the patient. So patient is able to clearly experience. Both of them are independent of the patient's will. Patient says, sir, it comes and goes on its own, it is not under my control. And both of them are without any real object. So what is the difference? What is the difference between hallucination and pseudo hallucination? Where it is occurring? Very good. So can you tell me how will you differentiate? Very good. Yes, I am very happy. Hallucination, we say it occurs in the outer subjective space, like this patient who is saying, sir, I can see another person sitting on the left side of you. So he is able to see the person outside in the external space. So this is hallucination. Then what is pseudo hallucination? In pseudo hallucination, the patient is able to experience it in the inner subjective space. Please remember this. Please understand this. This was the FMGE question asked last year. How to differentiate pseudo hallucination from hallucination? See where it is occurring. So what is this inner space? Let's try to understand. Sometimes there is confusion, sir, what is inner space? So inner space means, let's try to understand. So let us say all of us have been to some hilly area. So if I ask you to just create an image of the last hilly area you have been to, will you be able to create that image in your mind? Yes, you will be able to create. Then I say you have spent so much time there, let's come back to the class. So you will be able to come back. So where that image was created, it was created in the mind. Sometimes we say in the mind's eye, in the inner space. So this is known as the inner subjective space. So how will you differentiate? You ask the patient where he is experiencing it. So hallucination, he is experiencing it in the external space, in the outer space. Pseudo hallucination is experiencing in the inner space. Now let's also discuss one more phenomena. Sometimes they may ask question like this. So the image which we created, the normal image which we created of the hilly area, what is that known as? That is known as imagery. So sometimes they may ask you how to differentiate imagery from pseudo hallucination. So that image which you created, was it cleared or it was blurred? You will say, sir, it was not very clear. So that imagery was not clear. So but we know that hallucination is clear. Now tell me, that imagery, was it under your control or it was not under your control? You will say, sir, of course I created that imagery and I have now dissipated that. So it is under our control, okay. And it is, again, tell me, it is occurring in which space? It is also occurring in the inner space. So yes, it is also occurring in inner space, but we know it is different from pseudo hallucination. Imagery is a normal phenomena. We just experienced imagery. So this is how we can sometimes differentiate. I hope this is clear to everyone. Yes. In the movie, yes, in Lage Raho Munna Bhai, the actor Munna Bhai is able to see Mahatma Gandhi. Here Mahatma Gandhi, we know Mahatma Gandhi is no more with us. So it was very clear to him. It was independent of his will. Mahatma Gandhi would come and go on its own, and it was occurring in the outer space. So that was classical example of hallucination. I hope this is clear to everyone. Okay, I hope this is clear to everyone. Right. Okay. Delusion of persecution, because that was not there in the option. I hope you're asking this question, Dr. Anusha. I hope this is clear here. These were the options. So these were the options. I hope it is clear now. Yes. So let's also discuss various types of hallucinations. Again, these can be divided into five sensory organs we have, 5 sensory modalities we have. Based on that, we can divide. So auditory means patient is hearing something. Again, it can be bells, noise of bells, dog barking, or human speaking. So it could be anything. Visual means person is seeing something. Again, if I ask you most common Most common hallucination, it will be in the outer space. So patient says, sir, I am hearing a voice coming from outside. It is coming from within the room or from outside of this room, but it is outside my body. So this is hallucination, is outer space. Please remember external space. Okay. Pseudo hallucination, patient will say it coming from within. Okay. So my inner space. Patient said, sir, it is in my mind, I am able to see someone. So that is how we will differentiate. Okay. Most common delusion we discussed, it was delusion of persecution. If I ask you most common hallucination, it is auditory hallucination. It is auditory hallucination. Visual, again very important. Again, one important point about visual which I want you to remember is, again it is hallucination. It is a psychotic symptom, can be seen in conditions such as schizophrenia, acute psychosis. Visual, if visual comes in the option, which is very good, which is one important entity which you would like to see in the question. Yes, very important, may be suggestive of organic mental disorder. In organic mental disorder, if I ask you most common hallucination, it is visual. So please remember this point. I'll discuss one question. Many a time they twist this point and ask you a question. Okay. So if visual hallucination is given, try to see if they're talking about any organic condition. Of course, visual can also be seen in conditions such as schizophrenia. Okay. But please remember, try to see if they're talking about any organic disorder. I hope this is clear. Tactile. Tactile, yes, touch. Here it is also known as formication. Formication means that patient reports of insects crawling under the skin. So patient is able to experience. Somebody asked how to differentiate tactile hallucination from Ekbom syndrome. I'll discuss about that. Please remember, when we differentiate between delusion versus hallucination, this is very important. Both of them are psychotic symptoms. Delusion, hallucination, both of them are psychotic symptoms. Delusion is a false belief. Patient says, I know my neighbor wants to kill me. It's a false belief. Hallucination, remember, it is also false. It is false perception. Patient says, I can hear the voice of my neighbor. So he is perceiving something. There is perception involved. So delusion is thought. Hallucination is a perception. Please remember this very basic concept. I hope this is clear. So how to differentiate tactile hallucination from something known as Ekbom syndrome? Ekbom syndrome is basically delusion of parasitosis. So here patient has a delusion. That, sir, there are insects under my body. It is a belief. You ask the patient, can you experience those insects? He'll say no. I know that there are insects in my body. That is a thought. So that will be a delusion. While in tactile hallucination, patient will say, sir, I can experience, I can feel those insects in my body or over my skin. So this is tactile. I hope you are able to differentiate between delusion and hallucination. A good question you asked. Very good. Okay. It is also known as cocaine bugs or magnum bugs because it can be seen with cocaine users. Very good. Okay, can be seen in cocaine users. I hope this is clear. And again, they may have scratch marks. So this question was asked that a person comes with hypertension, with tachypnea, tachycardia and scratch marks. Which substance he is consuming? The answer was cocaine. So because scratch marks is telling that patient may be having tactile hallucination. Then olfactory means patient is able to smell something. Gustatory means he is able to taste something, but there is no object or no food on his tongue. So again, when these hallucinations come again, they can occur in schizophrenia. One important lobe abnormality. Again, for the time being, Hanikit, it was hallucination. It appeared because he was totally able to experiencing it, and outside it was. Okay, it was outside. Very good. In temporal lobe disorders, very good. In temporal lobe disorders such as temporal lobe epilepsy. Again, this is a very important slide. Please remember this, very, very important. I hope this is clear to everyone.